back at 8:14. The deadline for enrolling for Medicare is coming up, and as of January 1st, 5 big changes will take effect for Medicare, a federal health insurance program for adults ages 65 and older. To help navigate us through those changes and explain what we need to know, we want to welcome Dr. Reena Mehta from Uptown Allergy and Asthma. Thanks for being here.
Good morning. Thanks for having me.
Okay, so open enrollment for Medicare is open until December 7th. So this is really, you got about a little more than a week left to get that completed.
Exactly. So if you missed the news, obviously this is very important to think about. If you have Medicare, this is the time to make changes to your current plan to better understand it, or during this open enrollment period, you can have new coverage.
Sure. Okay, so there's some things that we really need to pay attention to if you're in this open enrollment process for Medicare. There are some changes. Let's walk through some of them. I know one of them is there are fewer Advantage plans available.
Right, and so let me just quickly run through the different parts of Medicare because it is very confusing. So Part A is where you have inpatient coverage, you know, if you're in the hospital and things like that. Part B is outpatient coverage like clinic, wellness visit, vaccines. Part C is your Medicare Advantage plan, which is a combination of Part A and B, and Part D is your prescription coverage. And so while there might be fewer plans available, the hope is that the ones that are available can encompass all of those needs, but you really do need to check what you are getting yourself into to make sure that you, for your own health, have all the things you need.
Okay, good to know. What are some other changes? I know out-of-pocket drug spending will be capped. So what does that mean?
So this is probably the biggest change that's happening. So up until now, we had this thing called the scary donut hole, where Medicare patients, essentially, they have some prescription coverage, which then gets capped. And then they're in this donut hole where they have to pay basically out of pocket for even up to maybe $8,000 a year to get coverage for their meds. So now with this Inflation Reduction Act, what they're doing is they're having a $2,000 max spending. Okay. So basically what that means is once you've paid $2,000 for your coverage of your prescriptions, then you enter what's called catastrophic coverage, where then Medicare will kick in. Okay. So now everybody will be capped at $2,000, and you can pay that $2,000 over time or all at once. There is a $590 deductible that you'll have to meet, and then after that you can pay 25% of the coverage up until you get to $2,000, and then Medicare will take over.
Okay, good to know. Plan premiums may rise next year.
Yes, and so obviously with the prescription Part D going down with this $2,000 max where people will be saving on their prescription drugs, it's possible that your premiums may increase, things like your deductibles, your copay. So you do need to be careful about understanding. You may not want to get the plan that has the lowest premium, because if that means that something else is higher, you really need to consider all things. But hopefully with the prescription costs being down overall, even if your premiums increase a little bit, hopefully you'll still be better off.
Now, this is a lot of information, and there are some other changes that are happening as well, but there are federal programs that are there ready to assist people who might need help during this open enrollment.
Absolutely. So this is very overwhelming. Yeah. Even as a medical professional, I'm overwhelmed with kind of understanding what my patients are going to need. And so there is federally funded programs that can help you. So you can go online to the Medicare planner tool. They have a tool online that you can put in all your information and they can help. There's also a program called SHIP, which is for seniors, that's federally funded through Louisiana. So if you look online and look for SHIP, you can find a counselor that you can be connected to who can help walk you through. So you may be totally overwhelmed with all the prescriptions, but if you can find somebody who can help you understand, okay, this is what your prescriptions are going to cost, this is the plan to pick, this is what your premium will be, it will be a lot easier for you.
Good to know, some help there. And again, just a reminder, open enrollment for Medicare wraps up on December 7th. Dr. Mehta, good to see you. Thanks for being here.
Thank you so much for having. Happy Thanksgiving.
All right, let's check it in.